Okay, so in this video, we're going to talk about the movements that are possible when the muscle that spans across a joint contracts, causing the bones to move. Now, here's a quick primer. We're going to come back to this when we talk about the muscles in the next chapter. But where the muscle attaches to the least movable of the bones, that's referred to as the origin of the muscle. And where the muscle attaches to the more movable of the bones, then that's considered the insertion. So for instance, the biceps brachii, which is the muscle on the anterior surface of the humerus, when the biceps brachii contracts, then where it originates at the scapula, so the coracoid and the acromion processes of the scapula, the muscle originates there, and the contraction of the muscle pulls against the bones of the distal the distal portion of the arm. And so that's what causes that movement, is the contraction of the skeletal muscle across the joint, pulling the more movable arm, the insertion, toward the origin of the muscle. So those are the terms origin and insertion that you see in your notes package. Let's talk then about some of the movements that are possible with, with the muscles across the joints. First are the gliding movements. That's the first type of movement. And gliding movement occurs among all of the plane joints that we see, say, in the carpals of the wrist, or if you look down, in the tarsals of the ankle. So those are gliding movements when we have those motions there. And if you remember from the previous conversation that we had in the previous lecture, those movements are very short, but the reason that we get such complex movements out of the wrists, let's say, or the ankles, is because there are so many different plane joints associated with the carpals in the wrist. So gliding movements are one type of movement. The second type of movement are the angular movements. Angular movements change the angles between bones. And so, for instance, if we look again at the elbow, we can do an angular movement using this hinge joint that is the elbow. So right now, the angle between the two bones of my arm, between the humerus and the radius and the ulna, is about 180 degrees. I can change that angle by making it smaller. So now it's about 90 degrees. There's the 90-degree angle. And I can keep making that angle smaller, 45, and so on, until I get to the very smallest angle I can get. So when I decrease the angle between two bones, going from 180 to whatever that is, maybe 20, 25 degrees, when I do that, that's referred to as flexion. So this is flexion when I decrease the angle. And I can also flex down here at the knee. So here is flexion of the knee. You can flex here at the hip. So this would be flexion of the hip. So all of those are decreasing the angle. The opposite of flexion is extension. So this would be extension here at the elbow with the fingers. Here I have the finger joints flexed. Now they're really flexed. And so this would be extension of those joints. I could do the same thing with my knee. That would be extension of my knee. So flexion decreases the angle, while extension increases the angle of the joint. We can also extend beyond the normal range of motion. So if this is my wrist joint flexed, then here is extension. I can also hyperextend the joint. So this would be hyperextension. You can also do hyperextension here at the neck, looking up at the ceiling, and I'm using my hand here to protect my neck. But looking up at the ceiling would be hyperextension of the neck. That's extension beyond the normal range of motion. Hyperextension at the knee would be a very bad thing. So it's difficult to hyperextend the knee and the elbow joints, but hyperextension there usually results in a breakage of a bone, or results because of breaking a bone somewhere in those joints. Let's see, there's a couple of other angular movements. The movement where I take my arm away from the body, or where I take my leg away from the body. Those two movements are called abduction. So if you think about abducting a child, that would be taking the child from his or her parents. Here, abduction is taking the arm away from the body, or the leg away from the body. The opposite of abduction would be adduction, like I'm adding it back to the body. So adduction brings the appendage closer to the body. This is adduction here. This would be adduction as well. I'm bringing everything toward the longest digit. So abduction and adduction are also angular movements. And then there's a last angular movement, which is circumduction. So with circumduction, I can take and move the joint in a circular motion. You can do circumduction with the hip as well, although it's a little bit more difficult. The connections here at the shoulder are a lot looser than the connections at the hip. So angular motions then are flexion, extension, adduction, abduction, and circumduction. So those are the angular motions. And then last are the rotational movements. Rotational movements are movements that spin a joint around an axis. And so and they have special terms for these rotational movements. Here would be medial rotation, this lateral rotation. So if I'm rotating toward the midline, it's medial rotation. Rotating away from the midline would be lateral rotation. And then this is also rotational movement. So the movement that we can see at the atlantoaxial joint between the atlas and the axis, that's rotation as well. All right, so then there are a number of special movements that I want to make sure that you know as well. If we rotate the arms so that the palms, which are, well, let's go ahead and stand in anatomical position first. So if we're in anatomical position and we rotate the hands so that the anterior surface of the hand now faces posteriorly, that motion is known as pronation. So this is pronation, the movement of the anterior surface of the hands toward the posterior. The opposite movement so that the anterior surface returns to the anterior, that's supination. And an easy way to remember those two different motions, when you supinate, you can now hold a bowl of soup in your hands. You couldn't do that if you were in this position. So supination brings your hands around so that you can, like you could hold a bowl of soup. Pronation takes you the opposite direction. So pronation and supination are two to know. Here now we have to look at my feet. If I turn my ankle so that the sole, the plantar surface, now faces toward the medial line, that is inversion. So I have inverted my foot. If I turn so that the sole now faces away, faces laterally, that's known as eversion. So inversion turns it inward, eversion turns it outward, if that helps you to remember those two. I can do a little bit more. If I bring my foot so that I'm pointing the toe at the ground, that would be known as plantar flexion, because I'm flexing the plantar surface. This is the plantar surface, the part that I plant firmly on the ground. So the plantar surface flexes, and I can point my toe. On the other hand, if you bring the plantar surface so that it can be seen, if you bring the toe toward the dorsal surface, so it's like you're bringing your toe toward your back, that's referred to as dorsiflexion. So dorsiflexion brings the toe back toward, like you're bending it back toward the dorsal surface of the body. So plantar flexion, and its opposite, dorsiflexion. All right, now, this is one of my favorite movements, just because it makes me look so cool. So I'm going to turn to give you the side view, and we're going to look here at my head and what I do with the head. So I can either protract, so that's protraction. When you push something out forward, the jaw can be protracted as well. If you go, really push your jaw out forward, that's also protraction. So protraction, the opposite, pulling it back inward, that's retraction. And the lower jaw can also be retracted when you really pull it back in. So protraction and retraction are two opposites as well. Let's see, here's another set of opposites. Elevation. So if you think about an elevator, it's going to take you up. Elevation goes upward, so I can elevate the shoulders. And the opposite of elevation, that's depression. So elevation and depression. Depression, I'm sad, so I depress the shoulders, they go back downward. Let's see, and that is it. So you've got it. All of the movements that I want you to be aware of. So let's just review them again very quickly.